Every year around the world, over 1.25 million people die because of road traffic crashes and millions more are injured. But we know that road traffic deaths and injuries can be prevented. The World Health Organization, together with world experts and partner organizations, has synthesized evidence-based measures that can significantly reduce road traffic fatalities and injuries. The result is Save Lives, a package with 6 effective strategies and 22 interventions for reducing the impact of road traffic crashes. These are S, as in speed management, L, as in leadership, I, as in infrastructure design and improvement, V, as in vehicle safety standards, E, as in enforcement of road traffic laws, and S, as in survival after a crash. S stands for speed management. The faster a vehicle is moving on the road, the more likely it is to be involved in a crash, resulting in injuries or even death. Speeding is a major risk factor, but speed management interventions can influence a driver's speed. Set speed limits appropriate to the function of the road. Enforce speed limits using speed cameras to identify offenders. And applying appropriate penalties such as demerit points on a driver's license. Modify roads to calm traffic, particularly where road users mix, with chicanes, roundabouts, road narrowing and speed bumps. Finally, require car makers to install new technologies that can warn speeding drivers or even slow down the vehicle for them. L stands for leadership. Leaders must ensure collaboration across a diverse group of actors and create an agency. Such an agency should spearhead road safety, develop a road safety strategy, and fund it. In addition, a road safety agency should evaluate the impact of road safety strategies, harmonize and improve road traffic injury data, and raise awareness and increase public support. I stands for infrastructure. Government should ensure that all roads, existing and new ones, include safety standards. Provide pedestrians with safe infrastructure, such as sidewalks. Create bicycle and motorcycle lanes. Make the sides of roads safer. Design safer intersections. Separate access roads from through roads. Create vehicle-free zones. Restrict traffic and speed in residential, commercial and school zones. And improve public transport. V stands for vehicle safety. Safe vehicles are essential to avoid road traffic crashes, injuries and deaths. The basic safety standards recommended by the UN are standards on frontal and side impact to protect occupants, electronic stability control to prevent skidding and loss of control when steering, softer bumpers and modifications to the front end of vehicles for pedestrian protection, seatbelts and seatbelt anchorage regulations, ISOFIX anchorage points for child restraints which secure the seat directly to the frame of the vehicle, and for motorcycles, anti-lock braking devices and daytime running lights. E stands for enforcement of traffic laws. Speeding laws should set speeds on urban roads of 50 km per hour or less, and local authorities should be able to modify these laws as necessary. National drink driving laws should be based on blood alcohol concentration and establish a limit for general population of 0.05 grams per decilitre and of 0.02 grams per decilitre for young or novice drivers. Motorcycle laws should ensure all motorcycle drivers and passengers wear and fasten quality standard helmets on all road types and no matter what the engine type. Seatbelt laws should apply to drivers and passengers on the front and rear seats. Child restraint laws should ensure the use of restraints based on age, weight, or height, and restrict children under a certain age or height from sitting in the front seat. As society changes, road safety laws need to be updated to account for new risks. Building public trust encourages people to obey the law, especially if they believe it is enforced fairly. S also stands for survival after a crash. In order to provide timely emergency care and mitigate the consequences of road traffic crashes, develop an organised and integrated pre-hospital and facility-based emergency care system. Ensure universal access to emergency care, regardless of ability to pay. Develop standards for emergency care at all facilities to ensure timely recognition, resuscitation, and referral of injured patients. Establish a government agency to coordinate pre-hospital and hospital-based emergency care. Assess the emergency care system in the country. Train health workers, first responders, and others whose jobs often put them at the scene of crashes. Prioritizing investment in these 6 strategies and their related interventions will save lives. Find out more about improving road safety by reading WHO's Save Lives package.